helping people access the hub. Do you interact with the hub much?
No.
No, you haven't. Okay, so that's interesting.
So I can talk a little bit about that, because that definitely for youth is really where you should be starting. And I'm not sure if anybody here in this room is a mandatory reporter, which basically if you're a social worker or in the healthcare field, you're mandated by state law to report certain situations, and those are, in cases of abuse and neglect, you have to report if there's an unaccompanied youth who is under 18 and is out by themselves. One thing to keep in mind that people don't always realize is if you are a mandatory reporter, you are a mandatory reporter 24 hours a day. So even if you're not at your typical job and you're out volunteering somewhere, you're still a mandatory reporter. Now most of you probably are not mandatory reporters, but if I were you, I would basically consider myself a mandatory reporter. Because there's a reason why mandatory reporters are mandated to report, because it really is in the best interest of the person that you're working with. In the case of unaccompanied youth, what you're required to do is make a report to the hub, which is basically Child Protective Services. And it's one of the services that's listed on the 24-hour emergency services that's in the homeless gear book, and that you guys have gotten tonight and everything. But I really would strongly encourage you that if you become aware that you're working with a youth who is by themselves, somebody who's under 18 who's by themselves, to call the hub and to talk to them, to make a report. And a lot of times people still think of CPS as this kind of police force that comes in and grabs children and sticks them in these horrible foster homes, and they feel like, well, man, they probably are just as well off if they're, if I don't report than if I do. And that really, especially in Larimer County, is not the case. I mean, there has been a huge shift in how child protection works in Larimer County, and it really is focused on the safety of the children, as well as providing support to the parents, if that's appropriate. And they definitely will determine that. I mean, they recognize that there are plenty of times that these youth are running away from abusive homes, and the last thing they want to do is put the kids back into those abusive homes. The other thing to recognize with that, though, is if no report is filed, maybe the kid shouldn't go back to that home, but maybe there are other kids in that home. And if no report is filed, those other kids are going to continue to suffer that abuse. So even if reconnecting the child with the family is not the best course of action, it still is really important to make a report. And in some cases, there are mental health issues or substance abuse issues that led to the child running away, and they really would be better off if they were back at home. They have that support system. They have parents who have insurance, who can get them connected with therapy and everything. So, not making that assumption and really turning it over to the hub. And they really do amazing work with the youth. If they determine that the youth shouldn't return home, they can get them connected with programs like the Matthews House and Turning Point and programs like that. If they're 17 and a half years old, they typically will just provide them with some case management services and say, you're close enough to 18, we're not gonna try to make you go back to your home or anything. And for even the younger adults, sometimes they will actually help them with filing the paperwork to become emancipated youth if they feel like that's appropriate. I mean, there are some kids out there who are stably employed and they're doing well in school, and they don't want to go back to their parents because their parents were abusive, or their parents aren't accepting of the fact that they've come out as gay or lesbian, whatever it might be. And the hub can actually help them become emancipated so that they have the legal rights that they need to actually be successful. So, you know, I definitely would strongly encourage you to contact the hub. It isn't a scary place. Also, their hotline is 24 hours a day, and they can also give you a lot of just great advice. So even if you know, don't want to make an official report, it's always nice to have somebody to bounce ideas off of. You know, if you can ask somebody, half the time just in asking the question, you come up with a better idea. So I mean, it's great to have somebody just to be able to talk to people, talk over problems with. You know, the other thing around youth is it's fairly unlikely, especially since most of the youth have that picture of child protection as being this horrible place, that too many of the runaway youth or the unaccompanied youth are going to tell you they're 17. Very few will ever tell you they're 18. Conveniently, there's this huge chunk of kids that are 19 and 20 years old. Because, you know, they know if they say 18 that you might question it, but if you say 19 or 20, you know, it's just like people with fake IDs. They never say 21, they're always 22, 23. It's the same thing. And so that goes back again to that engagement piece and just that relationship building up that trust. You know, if you go up to them and very first thing you do is say, "You look like you're under 18. Can I see some ID?" There goes any chance of building a relationship with the person. But, you know, building that relationship and then letting them know that you are a safe person to talk to, that you want to get them help, that you know of resources that may help them. You know, however you go about it, even if you have to kind of talk around it, you know, well, you know, you're a younger individual, you know, I know that you're over 18, but, you know, you may have some friends that are actually under 18. So, you know, here's some information on some services that, you know, that they could access if you just happen to be talking to any kids who are under 18. You know, instead of identifying them as, you know, the youth that you're trying to get connected with services.
I have a friend and he was wondering.
Yeah. So yeah, I mean, anything you can do to, you know, to try to build that relationship and get them engaged, because they're an incredibly vulnerable population. You know, incredibly vulnerable in terms of being victimized, especially when it comes to some of the prostitution and stuff. A lot of times, you know, it's girls who also have developmental disabilities. You know, the drug addiction is pretty close behind if they didn't have a drug addiction beforehand. A lot of times they end up with a drug addiction because people are giving them free drugs, basically trying to get them addicted. So it's an incredibly vulnerable population. So as you come across youth, I definitely encourage you to take a little bit more time. The other issue with youth that is really key for you guys is they don't know how to be homeless. You know, you come across somebody who is 55 years old and who's been out on the street for 10 years. Well, they've survived on the street for 10 years. They clearly know how to survive on the street. But a youth that just ran away from home a week ago, they don't know how to make a proper fort in the snow to, you know, to keep themselves warm in the winter. You know, they don't know that they shouldn't sleep too close to the river because the water will rise and wash them away. I mean, all those little things, they just haven't learned yet. And if we're lucky, they never will have to learn those things. We'll get them back into housing and, you know, it'll just be a short little period in their life, and we definitely don't want them to become accustomed to being homeless. But I would definitely put a special emphasis on serving that population, because it's an incredibly, you know, vulnerable population.
Well, add to that, they've still got developing brains.
Yeah.
So, you know, they're not even with the full adult brain. You're trying to figure this all out. And I've had numerous people in my office, even 20, who don't understand why other people are the way they are. It's a whole new world, adult people. And so they're bouncing ideas off of me, which, you know, I can't, like, answer specifically, but they're saying, like, so should I trust this guy who's going to give me a ride, you know? And so you can't just say, no, no, no. But you can help them figure out, you know, what are their flags that they're noticing about this situation, so that they start to realize they can sort through this stuff and what's important to figure out in those. So just being able to say that would be hard to sort through. I'd be wondering about this or this, you know, and kind of plant a couple of seeds of things to consider. That's kind of how I do those conversations. It's our kids. That's how old my kids are. And they're just starting to get the hang of how the world works and who people are and how people are. And so a lot of misplaced trust. And especially since their trust has already been violated like how many times. And so really, untrustworthy people, that's who they know. So it's tricky. It's tricky. And I agree with you. I worry for them and fear for them. And they act really tough. And they're not.
Yeah.
Yeah.
Yeah, they usually are the ones that come in here and try to kind of take over the building and act all macho and everything like that. And, you know, the older guys are just laughing at them, like, you guys haven't seen anything yet. And again, we hope they never see what being out on the street really is like, because it's a horrible experience. And it will ultimately, you know, lead down the path of drug addiction and, you know, mental illness and becoming chronically homeless. So, I mean, that's definitely a group that the sooner we can intervene, the better.
And the age thing's tricky. We have that conversation all the time, and you know, we've been seeing these folks a lot, but like, how old do you think that guy was? And you know, generally, what you think they are, go down about 10, 15 years, and that's their real age. That's their real age. So when you encounter somebody out on the street who says that they're 50 or 55, they are elderly on the street. How many people have we had that made it to 60? It's so few. Not many, and very. I mean, I think it's like 0.5% of our folks make it to 70. The life expectancy for somebody who is homeless is 30 years less than your average person, because the life on the street is so difficult. So, you know, I mean, for some of these kids, if they're honestly 20 years old, they, you know, are basically having their midlife crisis if they remain out on the street, because they'll be lucky if they make it to 40 or 45. So that's scary, but also, so you're not really sure how old the people are that you're dealing with. So then again, some of those cues you were talking about just kind of go there more than the chronological age sometimes. And also, because some people, yeah, they might be 22, but emotionally they're like 14. And
sure. And when there's been a history of trauma, they're delayed even more.
Yeah.
Right.
And when there's drug use, then that delays it even more. And yeah, I mean, it's just so much. Yeah.
So their age is a number, and you know, but I think the other piece is kind of those things that you were talking about. I think that kind of the overarching theme here is listening for information. Your stuff is really well put together for that, for helping us realize like what kind of flags and cues to be listening for. And then if you can kind of pick up on that, some stuff you'll want to reflect back, like we were talking about before, and say, yeah, it sounds like this is tough out here. It sounds like this is your concern. And some of it, you reflect it back, and they're going to be like, ah, you know, you figured it out. So it's good to reflect back on sort of concrete kinds of things. You know, there's a lot of stuff that we hear that we're like, oh, don't say anything. But then it's like, so maybe getting some gear. Yeah, we've got some of this stuff. They've got the bigger stuff at the Murphy Center. And it's all about gear. You know, of course, it's not about gear. But that's where you can go, because you heard what they were saying. Don't want to get into the touchy emotional area too much, but you want them to know that you heard them. And maybe you'd feel safer if you know, had a tent. Maybe you'd feel safer if you could get rid of that tent and be less noticeable. Maybe you'd feel safer if you. So you're talking about feel safer. You're not talking about the why, and then you're tying it to something concrete. That can work as a door in.
And I think another, you know, big flag is if you are meeting with a couple, and there are plenty of actual couples out on the street and everything, but if you are meeting with a couple where the guy is the one who is always talking, or you know, the guy does not like it when you try to meet separately, you know, with the woman. You know, those are big flags for us in terms of domestic violence or, you know, prostitution and things like that. So, you know, as much as possible, and it's a really tough line to walk, because, I mean, we've had conversations here where we've said, well, maybe we should make every couple meet with separate case managers. Whether they want to or not, they're going to meet with separate case managers. And then I think about the fact that, you know, me and my wife became homeless. No way would we want to meet with two separate case managers. Of course we would want to meet together. But at the same time, there have been plenty of times where, you know, we've had people fill out paperwork and they filled it out together, and then, you know, the woman had, the guy's gone to the bathroom for a second, and the woman has come up and said, is there any way that I can meet separately? You know, I mean, those things happen all the time. So, you know, obviously, you know, you gain that experience and everything, but just things for you to be keeping an eye on.
So that's one of those pieces. If you start to get a sense of maybe they'd like to separate out, you can just sort of on the side, you know, you can meet separately. You can get different case managers if you want. You can just meet one-on-one with staff. You know, you can kind of toss in a little aside of stuff like that. And you don't have to do everything in tandem. The Murphy Center will let you do that separately if you want. Just a couple pieces on that. That we do try to watch for that in here, and we try to. I mean, we have clothing bank conversations. Very interesting, where things start to come out. I don't know why it is. Folding laundry makes people talk, and also you're gonna mess up. I've been doing this 22 years, and I had somebody last week who was like, I don't need some case manager telling me what I'm gonna, you know. So, you know, and I listened to this woman say this, and she was older than me and had raised her child successfully, and I said, you're right. You're right. You need to tell me what you need from me. I don't need to be telling you all these things that are out there that we can do, and because I was trying to do my little summarizing thing, you know. I think I have this really great system, that's why I'm telling it to you, right? Sometimes it just completely falls flat. And so I just said to her, you're right, you've been successful all this time, you've hit this one thing. How can I help? What can I do that would be helpful to you right now? And that worked way better, and we got on quite well after that. So yeah, you're gonna mess it up. We try not to mess it up in ways that are really dangerous. If you're starting to feel really nervous about how it's going, pay attention to that. Something's going on, because you're picking up on something. Trust those instincts. If you're like this, I'm not sure how this one's going, actually. I'm a little concerned. And after all these years, we get those. Just listen to that, and then ease off. Just absolutely just ease off. Well, you know, here's where the Murphy Center's at. Cool, here's some gloves. Okay, cool. Hope we get to see you again. And walk out. And that's okay. That's okay. You did great. You did fine.
And people have bad days, you know. I mean, we have folks who come in here who are absolutely just a dream 99% of the time, but they got 1 hour of sleep last night, and you know they become very scary very quickly. So I mean, you know, even somebody that you've gotten to know and has been great to interact with for a long time, they may be having a bad day that day. So you know, keep that in mind. Well, we're getting very close to running out of time, and you know, I should have expected that when you get us up here talking about anything related to homelessness, that we can go on for literally days. So I know we didn't get into as much of the, you know, the resources and everything. I think the main, you know, ones that Rick had said that you guys were kind of interested in were, you know, some of the youth, some of the housing services, and then, you know, some of the mental health and substance abuse services. You know, with those, you know, again, the best thing to do is to be referring folks over here. One of the nice parts and one of the reasons that we created this one-stop shop with the Murphy Center is that if somebody walks into the mental health center, which in case you guys aren't all aware is now Touchstone Health Partners. So in the past it was Larimer Center for Mental Health, it's now Touchstone Health Partners. So if you start hearing that name instead, that's why. But you know, if you're going to walk into the mental health center, then just by simply walking in that door, you're basically having to admit that you have a mental health or substance abuse problem. By walking into the Murphy Center, all you're admitting is, I want a donut and a cup of coffee. So it's a lot easier for people to be able to walk in over here, get comfortable, to, you know, be able to meet somebody, put a face with a name, you know, get some really concrete services, and, you know, then when they're ready, we can get them set up with mental health services. So this really is the best place for them to start. for ongoing mental health services. Now again, if there's a crisis at night, somebody is suicidal or something like that, that's definitely when you want to turn it over to either the police, or on here we have the the on-call 24-hour connections, Touchstone Partners phone number, so that you can call up and again, if nothing else, just get some advice. They may say, okay, that person, they're depressed, but it sounds like they can make it to tomorrow, here's an appointment time, or they may say, yeah, let's get the police out there right away, but it's just another backup for you. Last kind of thing in terms of just process, because again, I wish we could have gotten into that a little bit more, because I think it really is important for people to understand that, even probably more than the actual programs themselves. In terms of just what people can expect when they come over to the Murphy Center, because I think that we probably are one of your main referrals that you make. When somebody walks into the Murphy Center, we do all of our appointments on a walk-in basis. We really have found that if you set appointment times for people who are worried about where they're going to sleep tonight and where they're going to get food, they don't make those appointment times. So it really doesn't make sense to have appointment times. It's better to just be available when they're ready to come in. So everything is available on a walk-in basis over here. We're 8 to 5 Monday through Thursday, 9 to 5 on Friday. When they come over in the morning, they don't necessarily have to meet with the case manager. They're welcome to come into this room, and we just have food and coffee and everything, and they could just hang out in here. And then in the afternoon, we have a van that takes folks over to Catholic Charities for lunch, and then they can hang out over at Catholic Charities. Don't even have to meet with the case manager. So if that's somebody's stumbling block, is I don't want case management or anything like that, say, okay, well, the next time the weather, it's raining outside and you just need a dry place to be, go over to the Murphy Center, you can get a hot cup of coffee, you don't have to meet with a case manager, and that's perfectly fine. We found that's actually a really great way for us to start engaging people, because once they get in here and they start seeing all the other cool services we have available, then all of a sudden they actually decide, well, maybe I do want to meet with a case manager if I can get some of these other services.
They will have to check in.
Yes, they will have to check in.
They will have to check in, so that interaction has to happen.
Everybody who comes into our front desk, and they have to check in just for safety purposes. We like to know who's in the building. But from there, if they're not interested in case management, they can just come in here and hang out. If they do want a case manager and it's their first time over here, they will fill out this huge packet and they will be annoyed. And we will try to be honest and acknowledge that it's annoying, and we wish they didn't have to fill it out, and we wish we didn't have to enter it into the computer system. So we're in kind of the same place. And then from there, they likely will wait. We see a huge number of people. We're actually one case manager down, but right now, but we only have 3 case managers here, and we see about 3,000 people a year. So that's a pretty hefty caseload, and unfortunately, it means that there's going to be a wait. So again, being honest with people and saying, you may go over there and you may have to wait for a little while to meet with the case manager. But at least, in the meantime, while you're waiting, they've got food and coffee and everything over there. We'll let people use our computers while they're waiting to meet with the case manager for the first time. Most of the time, we'll let people go ahead and sign up for a shower and laundry before they actually meet with their case manager, because we just make the assumption that they're ultimately going to qualify for those services. So we try to do some things to make the time go a little bit faster, but again, they probably are going to wait. Depending on the day, afternoons are better. We don't have as long of a wait. If somebody comes in, 9 o'clock in the morning on Monday, they'll probably wait a couple of hours. If they come in at, 2 o'clock on Wednesday, probably only going to wait, 20 minutes, half an hour. But we also never know what crisis is going to come up, or if everybody all of a sudden decides to come over Wednesdays at 2 o'clock, and that happens, then all of a sudden, today, Wednesday at 2 o'clock, everybody just showed up at the same time. It was like there was this bus that pulled up and everybody unloaded. So they will have to wait, but from that point, once they get done waiting, they'll meet with the case manager, and the case manager will start connecting them with all the resources. They don't, the great part about what our case managers do here is the folks don't need to know all the ins and outs of the Fort Collins Housing Authority programs. We say we're going to sign you up for the Housing Authority wait list. We're not going to make it overly complicated and say, okay, here are the 5 programs you're signing up for, and here are the federal statutes behind them. No point in doing that. We just say, we're going to get you signed up on the Housing Authority wait list. So, I mean, we'll get them connected with all the different resources. We'll help them kind of, you know, follow them through that process. Once they're set up with a case manager, you know, they can keep coming in every single day if they want. They can get mail here, they can get a voicemail box here. You know, we've got homeless gear here all the time. We've got computers, showers, laundry, employment classes. I mean, pretty much anything, you know, that's available. And that's not to say that everything is available in this community. You know, it's hard accessing medical services and things like that. But if it's available, we try to have it here, you know, at the Murphy Center. So, you know, encouraging people to come over, be patient with us, you know, being honest with them, whether it's about the Murphy Center or any of the other agencies, that it is a process. You know, it's unfortunately a bureaucratic world, and that stinks, but at the same time, you know, if people are willing to tough it out with us, we can have a pretty significant impact on their lives, and we can get them out of homelessness. They've just got to be willing to stick it out with us. So I think that's kind of, you know, about as much as we'll have time to cover tonight, but were there any questions or anything before we wrap up?
Could I make a suggestion that if anyone has questions come up as you're continually going out, that possibly they serve as a conduit, they come through me and then I get them distributed to whoever?
Yeah.
Okay.
So I think that a model that can kind of help you kind of get a handle on how the Murphy Center operates, you know, you've got that bridge metaphor, and think of it that the way I describe it, you can just cut me off if it's terrible, but my description of the Murphy Center is like, it's like a social work ER. I mean, really, it is. You know, I mean, people are coming in here and they are in absolute crisis. We're not going to take them through to the whole process where, you know, they get everything completed. What we're going to do is figure out with them what they want to work on, where they're going, what those resources are, help them understand how to get there and how to get that. But we're not going to come all the way, you know. So we're going to link them up and help them get there, and then they're going to have other supports in the community. And I think what's good about that model is it tells them that they're part of the community, and the community's out there, and they can utilize the community, and they can become a real part of it again. It's not just us.
Yeah.
We just get them back in there. So if that model helps you, I mean, you got to do paperwork even though you're in crisis. You got to wait even though you're in crisis. You know, you're going to get seen, and we're going to triage, and we're going to take it a level at a time for getting your care dealt with. You know, we're going to stitch you up before we're going to go send you off to have follow-up care with a different doc, right? So that's kind of how this is too. That model works for me.
You guys are really the paramedics who are getting the folks to the ER so that we can stitch them up and get them off to the actual specialist who will hopefully solve the problem for them. You know, before the outreach program existed, it was just a huge gap in the community. I mean, it's something that the Murphy Center would have loved to do, but we just simply couldn't, because that really, you know, just like you guys are trying to engage folks and get them, you know, willing to access services, that really is basically what we're doing, with a little bit of, you know, extra actually helping them navigate some of those services. But it's really difficult for us, again, to convince people. You know, we could put flyers up all over town and everything saying, Murphy Center, we've got all these great services. That's not going to get people in. What's going to get people in is you guys. You guys are the ones that are going to develop the relationships and the trust that people are then going to be willing to take that first step and come into the Murphy Center. And then we basically do what you guys do. We start developing a relationship with them and building up that trust, and then getting them connected with other resources. So we're basically a lazy version of the outreach team, and that we don't like to go out at night. We like to have nice 8-to-5 jobs with comfy offices. But otherwise, we're basically doing the same work you guys are doing. So we really appreciate what you're doing.
Absolutely, absolutely. And there's a couple more handouts over there that you can grab. There's food assistance programs and clothing resources. And as you walk out of here with all of these pieces of paper, realize that the clients walked out of here with all these pieces of paper. So if it's hard for you to sort out what all this is, yeah, it's a lot of information. So it's great if you can be helping them kind of sort through things together. That's wonderful.
Thank you.
Thank you, guys.
Thank you all.
Thank you.
Thank you.